Food interactions can have a significant impact on how well nutrients are absorbed and utilized by the body. Your body, yes. When certain foods are consumed together, different types of food comes in, depending on the types of food being consumed together, they may actually interfere with each other. And I don't mean like in a positive way, I'm trying to mean in like the negative way. So when you take two things together that do not go well with your body, they can actually have negative effects, potentially leading to nutrient deficiencies or sometimes even other adverse health outcomes. And understanding these conflicting interactions can help you as an individual make informed dietary choices, make informed choices on your meals, your snacks, your food, like even what ingredients to put inside your meals, and help you optimize the nutrient intake and avoid potential health risk. So this video is going to help you we're going to just talk about 5 common conflicting food interactions and give maybe a little bit of some examples, something you should actually take note of, something you should be aware of, these certain food combinations that you can avoid, and what you can actually use to actually maximize nutrient absorption. So first off, we're going to be talking about foods that contain calcium and iron. Now, calcium and iron, I'm sure a lot of you actually take a lot of meals that contain calcium and iron. So for calcium, I mean like dairy foods like your milk, and maybe for iron, you take meat or your leafy greens, vegetables, like a lot of vegetables are actually iron rich. And quite a number of you do not know, but now you know they have like conflicting interactions. So they can actually interfere, like calcium and iron rich foods, they can actually interfere with each other's absorption. So how does this happen? The calcium binds with iron in the small intestine and creating a compound that is actually difficult for the body to absorb. What are these health implications? This can actually be really problematic, like for those with low iron levels, as regular calcium intake with iron-rich foods can actually lead to iron deficiency. So when you take calcium and iron-rich foods together, is to actually create a compound that can lead to iron deficiency. And when there's iron deficiency, you have symptoms like fatigue, you're tired, you have a weakened immunity, and in some other cases, anemia, depending on how well or how much of these food combinations you're actually taking that would affect you. So some food combination examples that can lead to things like this, maybe when you take it over time. For example, you have like you're eating spinach and cheese, spinach and cheese squish, or yogurt with iron fortified cereal. It can actually prevent your body from fully absorbing this iron. And you need your iron in your body for production of your blood and all of that stuff. You need iron in your body, and you actually need your calcium for your bones. But now when you take it in the wrong proportion, or you take them in cases where your iron is not fully absorbed, then there will be iron deficiency. So what you can actually do, what are the recommendations, what do I recommend for you, is like you separate this calcium and iron intake, you space your meals. So for all those one of your meals that contain like high calcium, like your dairies, so much of your eggs, taking a lot of eggs and all, you can actually space them. You don't have to put so much of your vegetables in them or take them together with so much high vegetables. You can just space them. And for instance, your high dairy based foods, you take them for breakfast like your cereal, and then your high iron rich foods like your red maize, your lentils, your spinach, you take them for lunch or dinner. And this is really a good thing for you to do. So secondly, we're going to talk about coffee and calcium. Yes, those two actually do not have a good they interact negatively, and then they can cause some certain things in the body. So caffeine in coffee can actually hinder calcium absorption and also increase calcium excretion through your urine. And then consuming coffee with calcium rich foods reduces the calcium available for absorption, and this can really be detrimental to the health. So let me tell you about some health implications. So you can have like because this would cause poor calcium absorption. And poor calcium absorption, we know calcium is very beneficial and useful for your bones. It can actually weaken your bone density over time. Now, understand that taking these things one time is not something that would cause anything for a problem, but when you take it over time, like you're taking it consistently every day, taking so much coffee and calcium mixed foods together, you might not see the detrimental effects immediately, but over time it occurs and then it happens. And there will be an increased risk of osteoporosis and other bone related conditions, especially in people who consume caffeine very, very frequently. So, what are these food combination examples that can actually cause these things? So, for like maybe drinking a latte, that's coffee with milk, or having coffee with yogurt can actually limit your calcium absorption as the caffeine will interfere with the minerals. So you have to try not to do this so often. And what will I recommend? I would recommend that in order for you to optimize your calcium intake, you need to avoid taking coffee or other caffeinated beverages close to calcium rich meals. You get? So just try drinking your coffee at least an hour before or maybe after consuming any food that is high in calcium. So like your dairy products, maybe your almonds or your fortified plant milk, things like that. Like drink them like 1 hour apart. And this can actually really help. Yes. So next we have copper and zinc. What is this interaction, you might want to ask? Copper and zinc are actually absorbed through a similar pathway in the body, and a high intake of one of them can actually limit the absorption of the other. So you have excess zinc, for example, can actually inhibit copper absorption, or excess copper can actually inhibit zinc absorption. So if there's one, if one is more than the other in the body, it can actually limit the absorption of the other if you are taking them together. So what are the health implications of this? There will definitely be an imbalance of these minerals in your body. So if there's excess copper and then you take a food that has copper and zinc together, and then it reduces the absorption of zinc, then there will now be an imbalance of zinc in your body. So your body that needs zinc on a normal day for immunity, your bones and all of that, you don't have enough for it. So for instance, a copper deficiency from high zinc intake can actually cause anemia and immune issues. And once your immune system goes low, your body is actually prone to falling ill. Before you know it, you come in contact with all forms of viral infections and then bacteria. Like your body is just exposed to pathogens, and then you start falling sick so easily. And you're wondering, why is this happening to you? Whereas it's your own doing, taking food combinations or interactions that do not even go. While maybe a zinc deficiency from taking high copper intake can actually affect your skin health and wound healing. So you have an injury and you're wondering why you're not healing so fast. This is going to be the reason. So what food combinations can you see this in? So eating meals that are high in zinc and copper. So for zinc, maybe you're taking oysters, pumpkin seeds, and then copper, taking shellfish and nuts. So just like taking oysters and shellfish and nuts together, you're just having all these pumpkin seeds, all of it together. They can actually reduce the absorption efficiency of both minerals. So you're going to have to just check that you're not taking all of this together, like you're taking your oysters and your shellfish, your pumpkin seeds and nuts at the same time. You can have your oysters and then you can have your shellfish, but not together like in high quantities for a long period of time. They can actually have lead to imbalance of these nutrients. And what do I recommend? I recommend that in order for you to ensure like balanced mineral intake, you just to consume foods high in zinc and copper, just consume them separately. Incorporate like moderate portions of foods rich in zinc and copper in a varied diet rather than consuming them together in large quantities. Funny enough, if you take them like in small quantities, like I always say, everything should be done in moderation. So if you take them in small quantities, then definitely you will not have to encounter any form of deficiencies in any of these minerals. But if you take them in high quantities and if they're too large, then you can now start facing some of these complications. So next, we're going to talk about the fourth one, alcohol and nutrient absorption. Well, by now, if you've not seen it anywhere online, I'm sure you should know alcohol doesn't go with a lot of things. Food, medicine, quite a number of meals, alcohol does not go with them. But I won't say all, but there's just one, nutrient absorption, that I'm going to talk about. So alcohol actually inhibits the absorption of several essential vitamins, including B vitamins. So you have your thiamine, folate, vitamin B12. That is even why we recommend, like, pregnant women, like when you're pregnant, please just don't take alcohol, because at that point, especially during the first 6 weeks, 8 weeks of your pregnancy, which is where the neural the child is forming, like, neurologically, and then you need your folate, your folic acid, and then if you now take the alcohol, it will increase the excretion of these nutrients through your urine, and then they will not actually do what they have to do in your body. So alcohol actually inhibits the absorption of these essential vitamins, thiamine, folate, vitamin B12, B6, B5, and it increases the excretion of these nutrients through your urine and can actually impair the absorption in the small intestine. And you ask, what are the health implications? Simple. This chronic alcohol intake, like I said, if you take like just small quantity, it might not do so much. But chronic alcohol intake, like someone you're constantly taking alcohol, more than a whole bottle, 2 bottles, 3 bottles. I'm sure every single person, you would know the amount of alcohol your body can actually, the moderation in which your body can take, and that will not lead to something detrimental. Speak to your doctor or healthcare provider to help you with that if you do not know. Chronic alcohol intake can actually lead to B vitamin deficiencies, which are critical for energy production, brain function, and your red blood cell formation. So taking this alcohol and this chronic like alcohol intake combined with these B vitamins, you just find out that you're always tired, your brain doesn't function properly, you're not sharp as you used to be, and your red blood cell is not forming like it's supposed to. And this long-term deficiency can actually result in cognitive decline, fatigue, and anemia. And you're wondering, oh, why is it that I have a neurological defect, or I'm always forgetting stuff, dementia, all of that stuff? You don't know that is from your constant intake of alcohol, and it's combining with your folate, your thiamine, and vitamin B12 from the food you eat that is actually affecting you in a negative way. So, for example, food combinations that you can talk about: consuming this alcohol with meals that are rich in B vitamins, like whole grain pasta with spinach. So that spinach contains folate. That's why I said spinach. Or meats, like, your red meat dishes that contain like vitamin B12. It can reduce the amount of these nutrients that are being absorbed. And what do I recommend? Recommendations from me include that you just limit this alcohol intake to avoid disrupting your nutrient absorption. If consuming alcohol, just ensure like your adequate B vitamins intake from your leafy greens, your whole grains, and your meats in other means. In your other meals are just you consume this alcohol in small quantities rather than taking them so much, to avoid all of this. Yeah. And finally, the fifth food interactions that can be complicated or that can lead to some complications is grapefruit with your medications. I'm sure quite a number of you must have heard it a number of times, especially people in Africa. Grapefruit juice and your anti-malarials, it's a no combination. But grapefruit also affects quite a number of medications, whether in Africa or any other part of the world, North America, South America, Asia, Australia, whatever. You just need to know that grapefruit and your medication, and you need to know the type of medications that grapefruits affect. So for compounds like compounds in grapefruit can actually inhibit enzymes, mainly your CYP3A4, that is responsible for breaking down certain medications such as statins, calcium channel blockers, and immunosuppressants. This interference can actually increase the drug levels in the bloodstream and lead to amplified effects on the side effects. So some of these, your calcium channel blockers, that's for people that have maybe hypertension, so your amlodipine, and you're taking them with your grapefruit juice, and you're wondering why you're feeling the side effects so much. This is the reason why. Like, this is the reason why. Or even some of your statins, your simvastatin for cholesterol and all of that stuff, so it can actually affect it. Then what are the health implications? Elevated drug levels can actually lead to harmful effects, such as increased risk of muscle damage with your statins, or dangerously low blood pressure with your calcium channel blockers, like your amlodipine and ifedipine. And what food combinations can you actually find this in? So when you drink grapefruit juice with a breakfast that includes your medications like your statins or your immunosuppressants, it can actually lead to unintended consequences by raising the drug levels in your bloodstream. That's to say, once the drug level is raised in your bloodstream, so like for example, you're taking 5 milligrams of amlodipine in order to control your high blood pressure. I'm giving a random example here, and you now take grapefruit juice. It increases the concentration of these drugs in your body, and normally the 5 milligram is supposed to help you to control the blood pressure. So now once it increases the concentration, that 5 milligram doesn't seem like 5 milligram in your body again. It seems like 10. So now the blood pressure that's supposed to just go down a bit, it can be dangerously low, and this really dangerously low blood pressure is not good for you. You can just faint, you can just fall off, like it's not really helpful for you. So what I would recommend, just avoid consuming grapefruit or grapefruit juice with medications that are known to interact with these fruits, like your statins or your calcium channel blockers. And most essentially, consult with your healthcare provider or your physician so that you can identify safe alternatives, such as choosing orange juice instead of your grapefruit juice. Yeah. So thank you so much for listening to this. Finally, I just have to say that these conflicting food interactions just emphasize the importance of making balanced, informed dietary choices in order for you to optimize nutrient absorption and overall health. So just be aware, and by being aware of which foods may hinder your absorption of another food, or you can actually, it will help you make dietary adjustments that can reduce nutrient loss and improve your wellness. So separating conflicting nutrients, reducing your caffeine and alcohol intake, and carefully considering food drug interactions are really important steps for any individual, you and I, aiming to maximize our nutritional intake in our food, and it can potentially help us maintain a balanced diet. So thank you so much for listening. I hope you subscribe. If you enjoyed something like this and you actually gained value from this video, I would recommend that you subscribe, and you can check out our link in our bio and check out our stand store for anything you might be interested in. Work from home opportunities, or just looking to improve your business, any business you have. We have some recommendations to help you scale from being stuck to success, moving from 4 figures to 5 figures. Just check out the store and I'm sure you will find something that will be beneficial and helpful for you. So talk to you soon. Bye for now.